marot ka minsan nang hindi ka maging matandang dalaga.
Start
Asa
na,
pa tayo?
sir.
Wait lang. Saan na tayo? May mga, excuse me. Aminado ako na hindi ko natignan yung PowerPoint ng mycology, but then, may mga picture ba kayo ng mga fungus ninyo? Per fungus, wala. Hindi naman. Isa sa inyo
Wait, sir. Loading. Oh, alam ko meron. Meron po karamihan, pati po yung kung paano nagmamanifest dun sa skin.
Sige, sana ma-manifest mo din na may makahag ka today. Sige, mag-start na kayo. Nakakatawa kayo.
Good day, everyone. We are Group 3, and today we will be discussing the fungal infectious diseases. So this presentation will be done by Ms. Alzate, Ms. Cruz, Ms. Vina, Ms. Lopez, Ms. Arfano, and Ms. Perzosa. Next slide, please. So for the objectives of this presentation, it is to be able to understand the following. So the causative agents, the epidemiology, the diagnostic tests, and the first-line treatment of these various diseases. Next slide po. So for the first fungal disease we have is Malassezia furfur, which is the causative agent of Pityriasis versicolor. So it is highly prevalent chronic superficial infection of the stratum corneum, or the outermost layer of our epidermis, caused by species of the lipophilic yeast Malassezia. So these yeasts can be isolated from the normal skin and scalp and are considered a part of the cutaneous microbiota. So what are cutaneous microbiota? So these have a role of maintaining skin homeostasis. So they provide protection against invading pathogens and the modulation of the immune system. So most likely these infections are caused by endogenous strains. So currently there are 14 recognized species of Malassezia, but the vast majority cases of Pityriasis versicolor are caused by Malassezia globosa, Malassezia furfur, and Malassezia sympodialis. So what are the symptoms of Pityriasis versicolor? So this infection is characterized by discrete serpentine, hyper or hypopigmented maculae. So hyper, they have a lot of pigment, and hypo, they lack pigment, which develop on the skin and usually on the chest, upper back, the arms, and the abdomen. So as seen on the picture, it is not very noticeable if one is looking from afar. So these patches of discolored skin may enlarge and coalesce or come together, but scaling, inflammation, and irritation are minimal. So it is more seen as a cosmetic problem since it is visible. So pityriasis versicolor affects all ages, and the annual incidence is reportedly 5 to 8%. So the predisposing conditions include the immune status of the patient, genetic factors, and elevated temperature and humidity. So this disease is not contagious, and it is caused by the strain of the normal cutaneous microbiota. So the diagnostic tests for pityriasis versicolor are direct potassium hydroxide microscopic examination of scrapings of infected skin and Wood's lamp. So a diagnosis is confirmed by direct KOH microscopic examination of the scrapings of infected skin. So kuha sila ng sample from the infected part. So the potassium hydroxide works as an enzymatic agent that breaks down debris in a specimen, such as yung epithelial cells and white blood cells, to be able to view the yeast or pseudohyphae. So it is short, unbranched, non-pigmented hyphae, and spherical cells that are observed. So the lesions, when we use the Wood's lamp, they fluoresce under it. So it is an indication there's a bacterial or fungal infection if it fluoresces under the Wood's lamp. So the color of the Malassezia furfur, if you look at the last picture, it produces a yellow-green with black color. So for the treatment of this, it is daily applications of selenium sulfide. Topical or oral azoles are also effective, and the goal of this treatment is to not eradicate Malassezia furfur from the skin, but but it is to be able to reduce the cutaneous population to commensal levels. So the species of Malassezia noted, as well as Malassezia restricta, have been implicated as causes or contributors to seborrheic dermatitis or yung mas kilala nating dandruff. So this etiology is supported by the observation that many cases are alleviated by the treatment with ketoconazole, which is a topical azole. So rarely, Malassezia may cause an opportunistic fungemia in patients, which are usually infants who are receiving total parenteral nutrition or yung TPN. So it is a result of the contamination of the emulsion. Since most species of Malassezia require lipids in the medium for growth as it feeds on oil, which is present in our hair follicles. So in most cases, the fungemia is transient and eliminated by replacing the TPN and intravenous catheter. So in addition, another less common manifestation of Malassezia is folliculitis. Next slide po.
Wait. Malassezia muna tayo. Okay. For the Malassezia purpur, ang common name ng mga to ay an or up. Hindi ko alam kung narinig na ninyo yung up pero ang an usually yan yung naririnig ko din. And then, sabi ni Miss Lopez, normally found dito sa ating skin. So, normal skin flora natin to. And somehow it's not contagious. Okay? In terms of morphology, Malassezia purpur is often noted as spaghetti and meatballs. Yan. And then isa siyang dimorph